In trying to keep with his election promise, President Ali of Guyana announced a salary increase for 5,000 healthcare workers, to the tune of $1.5 billion annually. For a true democracy to survive, it is key that citizens have a healthy skepticism of their government. This is why questions must be asked, especially if a government is handing out such a tremendous amount of money. First, where is the government getting these funds? And second, how and who would be paying for this? Also, with this sort of socialist giveaway, one can only speculate that this money is being generated from the oil revenue. So, is this government mismanaging the country's wealth? In any event, the president said the following about the pay increase: "This represents a further installment of my government's unwavering commitment to continue the improvement of the working conditions of our employees in the public sector and indeed of all Guyanese." In relation to the increases in salaries for several categories of doctors, medical interns will see their minimum salary adjusted from $151,347 to $200,000, which represents an additional 32.1% increase on the current minimum salary. Medical officers employed at the Georgetown Public Hospital and other facilities will see their current minimum salary adjusted from $219,878 to $300,000, which represents an additional 36.4% increase. Medical officers who have completed 1 year post-employment experience will see the current minimum salary adjusted to $351,204, while those with 2 years of post-employment experience will see their minimum salaries adjusted to $414,032. Additionally, those with 3 years of post-employment experience will see their minimum salary adjusted to $446,160 in line with current practices at the GPHC. Specialist doctors, neurosurgeons, obstetricians, gynecologists, etc., will have their minimum salaries adjusted upwards of $276,536 to $450,000, which represents an additional increase of 62.7%. Several categories of nurses are also expected to benefit from adjustments according to the president. Nurse aides and patient care assistants will see their salaries adjusted from $80,892 to $100,000, which represents a 23.6%. Nursing assistants will have their salaries adjusted from $88,525 to $115,000, which represents a 29.9% increase being paid to nursing assistants. Midwives will see the current minimum salary being adjusted from $96,974 to $169,438, which represents an additional 74.4% increase. Staff nurses will have their current salary adjusted from $111,628 to $169,438, which represents an additional 51.8% increase on the current salary paid to staff nurses. Staff nurses, midwives will have their current salary adjusted upwards from $127,963 to $195,000, which now represents an additional 52.4% increase. President Ali further said that to ensure the public healthcare system is supported by qualified technicians and allied health professionals, a number of these workers will see adjustments in their salaries. Pharmacy assistants will see their minimum salary adjusted upwards from $84,662 to $100,000, representing an 18.1% increase. Dental and lab aides will have their minimum salary adjusted upwards from as low as $80,892 to $100,000, representing a 23.6% increase. Community health workers will see the current minimum salary adjusted upwards from $88,525 to $100,000, which represents a 13% increase. Medics will now have their current minimum salary adjusted upwards from $152,420 to $200,000, representing a 31.2% increase. Pharmacists will see the current minimum salaries adjusted from $127,963 to $215,000, representing a 68% increase on the current minimum salary. According to the head of state, the salary adjustments will take effect from January 1, 2023, noting that the government remains committed to bringing prosperity and improving the livelihoods of every Guyanese in every village and every profession. He added, "We are working day in and day out to make your lives better." The president urged those healthcare workers to deliver services at the highest level and repay the country with excellent care and customer service. On prima facie, this is a good day for Guyana and especially the healthcare workers, But he is a fool who fails to question his political leaders. What does the opposition position on this, or are they as well getting a cut of Guyana's wealth? If you like this video and want more information, please like and subscribe. Thanks for watching.